Welcome to MediByte. Today, I'm going to walk you through everything you really need to know about a rare but pretty serious infection, tularemia.
Rabbit fever. I mean, it kind of sounds like something out of a storybook, right? But it's a very real disease. Its more scientific name is tularemia, and really understanding it is so important for staying safe outdoors. So, okay, let's dive in and break down what it is and how it all works.
All right, we're going to break this down into 5 key parts. We'll start with the basics of what tularemia actually is, then we'll get into how it spreads, the different types and symptoms, how it's diagnosed, and the risks involved, and we'll finish up with how to treat and, most importantly, prevent it.
Okay, so first things first, let's start with the absolute fundamentals. What exactly are we even talking about when we say tularemia?
So, at its very core, tularemia is a bacterial infection. The culprit, the little organism causing all the trouble, is called Francisella tularensis. You find it a lot in wild animals, especially rabbits, hares, and rodents. And knowing it's a bacterium is absolutely key, because that tells us a couple of really important things: where the risk comes from, and, crucially, that it can be treated with antibiotics.
So the next logical question is, how does a person even get this disease? It's really not like catching a cold from a friend. So let's take a closer look at the actual ways you can get infected.
Now, this is what's really fascinating to me. Look at all the different ways you can get exposed. It's not just one thing. It could be a bite from an infected tick while you're out on a hike. It could be from handling an animal if you're a hunter. Or, and this is the one that surprises people, it could even be something as simple as inhaling contaminated particles while you're mowing your lawn. If an infected animal happened to be in the area. Wild.
And here's a really important point to remember, and honestly, it's a huge relief. Tularemia is not spread from person to person, so if someone you know gets sick, you don't have to worry about catching it from them just by being around them. That's a big deal.
Okay, so what happens once someone actually gets infected? Well, the disease can show up in a few different ways. And the specific type of tularemia you end up with, it all depends on how the bacteria got into your body in the first place.
No matter which type it is, the first signs often feel just like a really bad case of the flu. We're talking a sudden high fever, sometimes up to 104 degrees Fahrenheit, plus chills, headaches, and just aches all over. This is exactly why getting a proper diagnosis from a doctor is so important.
Now, this chart does a great job of breaking down the main forms of the disease. The one you see most often is ulceroglandular, which usually starts with a skin ulcer right where the bacteria got in. But, and this is important, if you look at the other types, you can see that just inhaling the bacteria can lead to the pneumonic type. And if the infection gets into your bloodstream, that can cause typhoidal tularemia. And let me tell you, those last two are the ones that are especially dangerous.
Right, so if someone has these symptoms, how do doctors figure out for sure that it's tularemia? And maybe more importantly, what are the risks if you just let it go untreated?
I want you to really pay attention to this number. It definitely represents a worst-case scenario, but it hammers home just how serious some forms of this infection can be if you don't get medical help.
The difference here is just, wow, it's stark. And this is exactly why this disease is taken so seriously. If you don't get treatment, the most severe forms, we're talking the pneumonic and typhoidal types, can have a mortality rate as high as 50%. 50! This is why a doctor will always ask about your outdoor exposure if you show up with severe flu-like symptoms. But here's the good news. With the right medical care, the outlook is excellent. Almost everyone recovers.
Diagnosing this is kind of like being a detective, honestly. Your doctor's going to ask you a ton of questions about your recent history. Have you been hiking, hunting, any tick bites lately? Then, once they have a suspicion, they'll run some specific lab tests to confirm it. They're looking for either the bacteria itself or for the antibodies your body produces to fight it off.
All right, now for what is probably the most important part of this whole thing, the solution. We know it's treatable, so let's get into the specifics of that. And even more importantly, let's talk about how to keep from getting it in the first place.
So the really good news here is that because it's a bacterial infection, antibiotics work, and they work really well. We use drugs like streptomycin or gentamicin, usually for about 7 to 10 days, and they're super effective. But the absolute #1 key, seeking treatment early. Don't wait. These 4 steps right here, this is your best defense. And they're not complicated. These are just simple, common sense things you can do to seriously lower your risk, whether you're out camping, hunting, or even just doing some yard work.
And this right here is a really crucial takeaway from the experts. The transmission isn't instantaneous. You actually have a window, a few hours, to find and remove a tick before it has a chance to pass on the bacteria. So a quick tick check after you've been outside, it can literally make all the difference.
You know, this brings us to a much bigger question. Tularemia is a classic example of what we call a zoonotic disease. That's one that jumps from animals to humans. So knowing that these things exist, how can we be more mindful when we interact with nature? Look, it's not about being afraid of the outdoors. Not at all. It's about respecting the incredibly complex ecosystems we're a part of and just learning how to navigate them safely.
I really hope this explainer has been helpful for you. If you found this information valuable, please do us a huge favor and like, share, and subscribe to MediByte. It helps us keep creating clear and reliable health explainers just like this one. Thank you so much for watching,